Today is day one. Found out I have cancer today, and throat cancer on my vallecula, to be specific. It's kind of a kick in the groin whenever somebody tells you that. And so the first thing you do is you start going online and trying to figure out, well, what are you gonna do? What do you expect? What's gonna happen? I didn't find a lot. There's one person I thought was who chronicled his journey pretty well. Anyway, I thought, it might be therapeutic for me, as well as maybe somebody out there, if I kind of chronicle my journey here. As I go through it, it'll help. It'll help me maybe stay focused on what the goal is, and then maybe give somebody else at least an idea of what to expect as they go through something similar. A little background: I'm 61. I had dipped snuff for a long time, most of my life, since probably I was 15 or 16 years old. And that's probably the cause, according to the doctor. But a few weeks ago, my wife and I were having dinner, and right after dinner I felt something in my throat, and I went to the trash can to spit, and it was a giant clump of blood. And after that, my just started bleeding from my mouth, pouring out of my mouth, in fact. We called my son, who's a doctor, and he said, get to the emergency room right away. We did. At the emergency room there, they initially diagnosed me with pneumonia, which turned out to be wrong. I saw a pulmonologist in the morning at the hospital, and he didn't think it was anything in in my lungs. He thought it was more an upper airway issue and recommended that I see an ENT. So about a week later, in a follow-up visit to the ENT, or to the pulmonologist, I had told him that I had had 2 more episodes similar to the first one, and he then decided to go ahead and schedule a bronchoscopy. And I was going to see the ENT, I think, the next day. When I saw the ENT on the next day, the ENT put a scope in. Actually, his assistant put a scope in my throat, and the assistant didn't see anything. And then when the ENT, the doctor, actually came in, he decided that he wanted to take a look as well. And when he did, thank God, he found what he believed to be some sort of maybe a cancerous mass on the vallecula in the back of my throat that needed to be biopsied. So I think a couple days later I had my bronchoscopy, and then I had 2 days after that I had the biopsy. That was last week on a Friday. Today is Wednesday, and I got the results this morning from the biopsy. The results were squamous. It was cancer. So where I'm at right now is that I have an appointment with an oncologist on Friday. The oncologist will probably just kind of go over what some options are, but prior to making any decisions, I'm sure they're going to want to wait and see what the results of a PET scan that I now have scheduled for. It's in about 2 weeks, a little over 2 weeks, 2 weeks and a day or so, I think, that I'll have the PET scan. So that means I've got to wait that long to determine, what the extent of this cancer is. The ENT seems to think that it was caught pretty early, and that it's treatable. But again, they want to do a scan to look at your lymph nodes and everything else and make sure. So I will I'll make a video as kind of each milestone progresses, and just that way, chronologically, somebody else who may be going through something similar will kind of know what to expect and maybe how to deal with it. So, and I'll try and keep my ass in focus, right? So, anyway, appreciate you following along on this, and hopefully it helps you. I'm quite sure it's probably going to help me stay focused on what I need to do to get better. So, thanks.